Okay, guys, this is Beefy. We're discussing hairline fractures, what causes them, and how they're repaired. So here we go with tonight's discussion B for you. Please join me in tonight's presentation B. A hairline fracture, also known as a stress fracture, is a small crack in a bone that typically results from overuse or sudden impact. These fractures can be difficult to diagnose because they may not always appear on x-rays and can mimic symptoms of other injuries like sprains or strains. Causes of hairline fractures: repetitive stress from physical activities, high impact high impact activities like running or jumping can lead to hairline fractures, especially if there is a sudden increase in intensity or duration. Trauma or sudden impact: a direct hit, fall, or injury can cause a hairline fracture without breaking the bone completely. Weakened bones due to medical conditions like osteoporosis, kidney disease, and progeria disease can weaken bones, making them more susceptible to fractures. Fracture risk factors. Certain factors increase the likelihood of developing a hairline fracture, including advanced age, poor biomechanics or body movements, weak or tight muscles, medical conditions affecting bone density, worn out or poor cushioned shoes, running or standing on hard surfaces for long periods, recovery process. Hairline or healing time varies depending on the severity of the fracture, but it generally takes weeks to months. Treatment often includes, give me 1 second, guys. Gotta change paper. Okay. Rest to allow the bone to heal, pain management with medication, physical therapy to regain strength and mobility, proper nutrition to support bone health. Preventing hairline fractures involves strengthening bones, reducing stress on joints, and maintaining proper movement mechanics. Here are some effective strategies. Gradual increase in activity. Avoid sudden increases in exercise intensity or duration. Incorporate cross training to reduce repetitive stress on specific bones. To proper footwear Wear well-cushioned, supportive shoes to absorb impact. Replace worn-out shoes regularly to maintain shock absorption. 3. Nutrition for bone health. Ensure adequate calcium and vitamin D intake to strengthen bones. Consume foods rich in magnesium and phosphorus or optimal bone density for optimal bone density. 4. Strength training and flexibility. Engage in weight bearing exercises to improve bone strength. Stretch regularly to maintain muscle flexibility and reduce strain on bones. 5. Rest and recovery. Allow sufficient rest between workouts to prevent overuse injuries. Okay. Next page. Put that straight. Listen to your body. Pain or discomfort may signal the need for rest. 6. Surface considerations. Avoid prolonged running or standing on hard surfaces like concrete. Use shock absorbing mats or soften terrain when possible. Would you like recommendations for specific exercises or dietary plans? A hairline fracture, also known as a stress fracture, can be tricky to identify because symptoms often develop gradually rather than suddenly. Here are some common signs to watch for. Okay, pain that worsens over time, initially mild but intensifies with activity. Often subsides with rest but returns when weight bearing resumes. 2. Swelling and tenderness. Localized swelling around the affected area. Tenderness when pressing on it, on the injured bone. Bruising or discoloration. Some cases may show mild bruising. Skin around the fracture may appear reddish or slightly discolored. Difficulty moving or bearing weight. Pain may cause limping or difficulty walking. Reduced range of motion in the affected limb. Okay, 5. Hard lump formation. Okay, small, firm lump may develop over the fracture sites. Since hairline fractures can mimic other injuries like sprains or strains, medical evaluations is medical evaluation is crucial for an accurate diagnosis. Would you like to know how they are diagnosed or treated? Treating a hairline fracture focuses on restoring bone strength and reducing pain and preventing further injury. Here are the key treatment options. 1. Rest and activity modification. Avoid high impact activities to prevent worsening of the fracture. Limit weight bearing movements until healing process. 2. Immobilization. Okay. Splints, casts, or braces may be used to stabilize the affected area. Crutches can help reduce pressure on the injured limb. Pain management, over the counter pain relievers like ibuprofen, acetaminophen can help. Ice therapy reduces swelling and discomfort. For physical therapy, gentle exercises improve mobility and prevent stiffness. Gradual strengthening helps restore function without re-injury. 5. Nutrition for bone healing. Calcium-rich foods, dairy, leafy greens support bone repair. Okay. Last page, guys. Vitamin D aids in calcium absorption for stronger bones. 6. Surgery in rare cases. If the fracture fails to heal or is severe, surgical intervention may be required. Recovery time varies, but most hairline fractures heal within weeks to months with proper care. Would you like guidelines on exercises for recovery? Okay, guys, for that. So that's B for you. I'll be back on if I find a C to do. Meaning C show. I don't know what I want to do yet, so I'll jump back on when I figure that out. For now, Gator Wellness. Take care, folks. Be back on with C.